Hey y'all, today I'm going to talk about hand expression because I believe it is a great skill to have and a great tool to have in your toolbox as a breastfeeding mom and a pumping mom. So, before we get started and before I show you how to do it, I want to just talk about the letdown reflex a little bit. So sometimes with hand expression, oxytocin hasn't been released beforehand, so it may take a little bit of time for the milk to be released. So what you can do to promote that is to massage the breast and then also apply heat. You don't want to apply too hot of heat or you can burn the skin around on the breast or on the nipple, which we definitely don't want. Okay, so after you have encouraged and promoted the letdown reflex by massage and heat, we are ready to get started. You can also do the same thing, massage and heat, if you're having trouble with the letdown reflex with breastfeeding or pumping as well. Okay? So what you want to do is you want to position your fingers right around the areola, and once they're positioned, you want to compress back into the chest wall and compress. Press, compress, press, compress, press, compress. All right? So you want to do that for about 5 to 7 minutes, and it may take a few minutes for your milk to actually be ejected, and that's okay. Just be patient with yourself. It does take practice, but the more you do it, the more confident you'll be in it, and you will be successful in it. And then once you have done the first breath, then you'll want to go to the second breath, 5 to 7 minutes. Then you'll go back to the first breath, 3 to 5 minutes, and then back to the second breath, 3 to 5 minutes. And you're going to continue on that until you empty the breasts, essentially. And you can do this for emptying the breast. You can do this for spoon feeding or cup feeding, like I stated. You can also do this to relieve engorgement. There are the same ways that you would breastfeed, the same reasons for breastfeeding, the same reasons for pumping, you can also do for hand expression. One of the reasons that this is not something that moms prefer is because it is more taxing than pumping. It does require a lot more work, essentially, because you're the one sitting there and compressing the milk and encouraging the milk to be ejected. But one of the things that you can do is actually get dad involved in this, and he can express for you. And for some moms, that is not something that they want to do, but some moms and dads, this is a really great way for them to bond and for dad to feel like he's part of the breastfeeding experience, which is huge. And so what we want to do is I want to encourage as many dads to be a part of the process as they can. And for a lot of the ways in breastfeeding, dads just don't have a lot to do, and they kind of feel like their hands are emptied and they don't know what to do. And this is a really great way to encourage and promote his responsibility and make him feel like he has an important job in it. So if that's up your alley, feel free to do that. Just make sure that you teach him the same method of taking his fingers, and you can do it like this, you can do it like this, whatever way, but just make sure that your fingers are, or yours or his, are around the areola, and then he or you compress, press, compress, press, compress, press. And again, just be patient with yourself. It takes time to practice this and to learn it, but it is a really great skill to have.